Welcome to this month's Fit for Colorado Talk to the Doc chat. I'm CBS4 anchor and health reporter Kathy Walsh. For the next half hour, we'll be chatting about fitness and health issues here on CBS4Denver.com. And throughout the chat, we encourage you to ask questions by simply typing them in the chat window at right, and we will do our best to answer those questions. In today's chat, we're going to discuss headaches. A headache is defined as pain in the head or upper neck. Over 45 million Americans suffer from chronic recurring headaches. Of those, 28 million suffer from migraines, or headaches that cause significant pain for hours or even days. Joining me today is Dr. Jonathan Scott, a neurologist with the Medical Center of Aurora, and Rachel Lindstrom, a study manager with the University of Colorado Denver Center for Human Nutrition. All right, Dr. Scott, there are several types of headaches. Let's take a look and talk about each one. First of all, tension, also called chronic daily headaches. My understanding is the most common, mild to moderate pain, muscle contraction type headaches. Fill us in.
Well, exactly. Tension type headaches are probably the most common type of headache, and they occur in a large percentage of the population. You alluded to some of the figures there, and we see that a lot of patients have headaches. Tension headaches are very commonly a muscular origin headache, very commonly induced by stressful situations and when the muscles contract and things like that. They're very common. Typically, they don't last for much longer than a few hours. They're very often treated with over-the-counter pain medications like Tylenol or ibuprofen. But unfortunately, they can be very disabling for patients. You alluded to the chronic daily headache or chronic type headaches. Some patients will actually have tension type headaches that last for days and weeks and go into a daily type headache. So they can be very severe and very disabling for some patients.
All right. Sinus headaches. That's the other one that I have heard about, and I hear people comment about all the time, especially people who are prone to sinus infections.
Sinus headaches are once again another type of headache, and the sinuses are air passages in the cranial vault that sometimes can be infected or inflamed, particularly in the flu season. We get colds, they get inflammation, and they can definitely cause headaches. Oftentimes we'll have patients that will know that they're going to get a headache when the weather changes. And it's thought that changes in the barometric pressure can sometimes cause headaches to come on or to get worse and things like that. So sinus headaches are also a very common cause of headaches as well. Okay,
cluster headaches. This one, my understanding, is the least common, can possibly be the most severe?
Well, that's a good point. They are very uncommon. Typically about 1 in 1,000 people get a cluster type headache. They're called cluster because they come in clusters. So patients will have them every day or on a daily basis for a few days or a few weeks in a row. They come on very suddenly. They're very sharp. Typically they involve one side of the brain. They can be associated with some tearing of the eye or the stuffiness of the nose or some drainage. And they typically last about an hour, 30 to 60 minutes, and then go away. So they come in clusters. They're very severe. And the good news is they typically come for short periods of time and they go away.
So for a short period of time, you can't function, though, with one of those, huh?
Well, that's exactly right, and it's not all that uncommon that we see these cluster headaches in the emergency department because they come on very suddenly, they come on very severely, and the pain can be very debilitating. The good news is that it's typically short-lived.
All right. Migraines, a little different story. That's the fourth one. That's the one you hear so much about. Pain, moderate to severe, pounding, throbbing, can last 4 hours to 3 days. I've actually had friends say, leave me alone, and you know, through the whole weekend, they can do nothing.
Well, that's exactly right. Migraines, they are much more common than the cluster type headaches. They affect a large percentage of patients. About 6% of men and up to 18% of women will have migraine headaches. Typically, they are associated with those symptoms that you mentioned. Oftentimes, they're unilateral, meaning on one side of the head. They're pounding, they're pulsating. They last at least 4 hours if they're untreated, but they can last up to 3 days. Oftentimes they're associated with some visual changes, some nausea, vomiting, some oftentimes patients will describe a sensitivity to light or sound. So and the patients typically like to just kind of, if they're unable to be treated with medication, like to just kind of sleep them off, and they can last up to 3 days, so they can be very severe. And the problem with migraines is they tend to be more recurrent than the cluster type headaches. The cluster headaches will come and will kind of go away, but the migraines tend to stick with the patients. So patients can have, you know, a migraine as little as once a year, once a month, but oftentimes the patients in my clinic, they have them up to a couple times a week, and those can be very disabling.
No kidding. Rachel, when we talk headaches, where does nutrition come in?
So I think nutrition, exercise, and general healthy lifestyle is really helpful, especially with tension-type headaches. Eating the right things and taking care of yourself in that you're eating normal periods throughout the day. So trying to get breakfast, lunch, and dinner will help, especially with headaches that are associated more with fluctuations in blood sugar levels and things like that. And exercise helps more with the tension-type headaches and relieving some of that stress and tension that can build up.
So it seems like you have to be aware of what may bring it on. Like if you know you haven't eaten in 5 hours and you start to feel it coming on, can you eat something and it could prevent a headache?
I think it can. For some people, if it goes past a certain time point that they haven't eaten, at that point they're probably going to have to take something for the headache. Just eating something won't necessarily get rid of it. But for a lot of people, if they really are careful to eat throughout the day and nothing that causes big spikes in blood sugar, but you know, just good fruits, vegetables, whole grains, lean proteins throughout the day, they can prevent a lot of headaches from coming on.
How important is it to drink a lot of water as opposed to other things, perhaps with caffeine?
I think that's a great question. In fact, I brought my water bottle. This is 32 ounces. And actually, people are supposed to be drinking 8 to 12, 6 to 8 ounce glasses a day. That's 2 of these per day. And a lot of people say, oh, that's a lot of water. But that's what we need to be replacing, especially in a climate like Colorado, where we do have such a dry climate, and with the higher altitude, you need at least 2 of these per day. And it's hard to get that. I myself rarely get 2 to 3 of these a day. Maybe I'm closer to about 1. But I think that some things people can do to help it go down, so to speak, is to add lemon to it. Or what I like to do actually is cut up a cucumber and put it in my water bottle at the beginning of the day, because then I feel more like I'm at a spa for the rest of the day.
Oh, there you go.
Things like
Psychological deal. But you know, I think with water, it's when you get used to it. At first, it's difficult. But when you get used to having that much, I mean, it becomes second nature. I get up in the morning and I'm not a coffee drinker. I start with a big glass of water. And if you start early in the morning, it's easy to get it done by the end of the day. So no good excuse on that one. Let's talk a little bit about headaches and heredity. Okay, my understanding is they do have a tendency to run in families. Is that correct?
That is correct, and it tends to be seen more in the migraine-type headaches. So we know that there's a family correlation with headaches, and particularly the migraine-type headaches. And so it's not uncommon to have a family member see a family member with a headache, and then they tell you that their daughter, who's 15 years old, also has headaches, and their aunt also has migraine-type headaches. And so we do see clusters of hereditary, specifically in the migraine-type headaches.
It's interesting you said that about children. Let's take a look. Most children and adolescents who have migraines have other family members with migraines, like you said?
Exactly, and once again, it speaks to this hereditary component of it. We don't know all the exact factors that contribute to the migraine headache, but there is some genetic component to it.
And the chances of getting a headache, when both parents have them, there's a 70% chance a child will develop them. Wow.
Well, that's exactly true, and whether these are migraine headaches or even some of the tension headaches, there may not be a genetic component to the tension-type headaches, but some of the same risk factors that were found in the parents, whether it be a high stressful life, not having the right nutritional component in their diet, or perhaps a lack of exercise, probably also correlated to the children as well.
And think about that. I always think about genetics, but actually lifestyle, as we've talked about, makes a big difference. If only one parent has headaches, my understanding is the risk is about 25 to 50%. Makes sense.
It does make sense. Once again, speaking to probably both a hereditary component as well as a lifestyle component.
All right. I know so many people out there have headaches. We really do want you to type in your questions. We have the folks here today who can answer them, so give us some questions. Headache triggers. We talked a little bit about some of those things, but Number one, you talked about stress. Is it that nowadays we see more and more people with headaches because we seem to live more stressful lifestyles?
That's a good question. I don't know if that's I don't know, but we do live a lot of stressful lifestyle, and especially with the economy taking a downturn a little bit, with all the stress that people are under, we do see probably an increase rate of headache in our patients, and so stress does play a big role in headache. And relieving that stress, finding ways to relieve that stress, can play a role in treating the headaches. And so oftentimes, when I'm talking with my patients about headaches, we'll discuss life stressors, and we'll discuss ways about coping with that stress. There are mechanisms to deal with that, whether it be through seeing a counselor or using biofeedback to try and alleviate some stress, or trying to find ways to deal with that stress, can help with one aspect of treating the headaches.
And Rachel, wouldn't you also throw exercise in there as one way to relieve some stress?
Definitely. I think that when people think about exercise, sometimes they think about it being an extra stress, in that it's one more thing to fit into the daily schedule. It's you know, it takes up time away from their family, but you can do just small amounts of exercise throughout the day. I brought my pedometer in today to, you know, it's just about accumulating steps. It's not necessarily that you have to go and sweat for 30 minutes at the club. It may just be that you need to go out, take 10 minutes every couple of hours from work, and just take a deep breath, walk around the block, and then head back. It's all about the small changes so that exercise doesn't become an extra stressor. And I mentioned this some other times, that America on the Move, we have a website that has all sorts of great small things you can start doing today to incorporate exercise into your lifestyle that hopefully won't be an extra stress, that it will decrease the stress, as well as interacting with people on the website to decrease stress.
All right. Alcohol. Boy, that's one everybody's like, oh, I'm going out for the weekend, I'm going to have a good time, gonna get some alcohol. They don't realize the next day, and that's not just because of a hangover, it can also trigger some major headaches, can it?
Well, it certainly can. Once again, you were talking about some of the triggers, and alcohol is a big trigger for headaches. Some of the other triggers are things like chocolate, certain things in diets, high fatty foods are a trigger to certain people, high salt intake is a trigger to some people. So the thing that we find with alcohol or any trigger is it's highly variable between each patient and between each individual. And so we really rely on our patients to take a good history of their headaches, what triggers headaches in them, and to avoid those things. But alcohol is one of the most common triggers, along with chocolate, unfortunately.
Okay, medication I saw. I thought that was interesting. You take medication to relieve a headache, but can medication sometimes bring on a headache?
Well, it certainly can, and one of the most common types of chronic headache is what we call a rebound headache, or a medication overuse headache. And what happens in this case is that patients will typically get a headache, whether it be a tension type headache or a migraine type headache, and they'll begin taking typically over-the-counter medications, whether it be Tylenol or ibuprofen. And over time, if they continue to use those medications too frequently, they begin to get a headache simply because of the overuse of the medications.
All right, something that you talked about earlier, food-wise, skipping meals, I've also heard, is something that can bring on headaches. Changes in sleep patterns, tension, kind of with the stress.